Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I'm the Chief Medical Officer of Protea Medical Center in Chandler, Arizona. Thank you for tuning in. Today we're going to do another quick Q&A. You know, you guys, when you comment, usually on Instagram I'm good, and excuse me, not Facebook, but Instagram I'm good, and to a better, I'm getting better at YouTube responding. I read all of your comments and they matter to me, and I try and respond to them in the screen in where you ask them. Sometimes your questions are really important. Sometimes your questions will benefit so many other women to hear them. And I love that. I want you to know that too. If you read through some of the comments on Instagram, I want you to know the parts I love the most are when someone asks a question and another woman somewhere else around the world responds to her with how she dealt with it and what worked for her. And I want you to know that is beautiful. And that is more than I could have ever expected or hoped for. And I love seeing that connection that's made between these people. So there's a lot of them. It's a huge tree of them. So I know some of them, someone might miss and someone might not find because it's hard to, tease through all of it. So some of them, Justin and I are going to pull out ourselves and make a video on. But I just wanted you to know, those of you who are responding and saying what your experiences have been, or being compassionate to that other woman who's experiencing that, I just see that. And it just makes me so happy to be a part of something like this and to be here now doing this with you. So thank you. The Q&A, the first one we'll go to, and some of these are really personal. And I'm not going to mention the person's name because of privacy's sake, but it is online. But it's just we get very vulnerable, like I've said in previous podcasts, when we express what we're going through and we're nervous, and this could be terrifying. So recently, someone messaged, and it says, "Hi, I don't know if you would answer this question, and feel free to even touch on it virtually, but I've had a heart attack at the age of 40 as a woman. I definitely want and still need hormone supplements in my near future, as I'm definitely at 43 going through menopause. Can I safely go through hormone therapy?" Okay. Yes, you absolutely can. Think about it. If you were to have a heart attack, would your doctor, your cardiologist, give you hormone blockers for that heart attack? No. And now, pause the video if you want and go look up online using like Google Scholar, not regular Google, but like Google Scholar or some other little bit more focused search engine, not something that's going to be catering to advertising dollars and people's blah, blah, blah. But start looking at the role estradiol has in heart health. Estradiol's impact on your heart is significant and understood and documented. It improves HDL cholesterol. It does help benefit your heart. So why would you think that estrogen will hurt you? Estradiol does not harm your heart, and estradiol does not cause heart attacks, and estradiol is not the problem. If it was, women during the years of menstruating and their lives when they're having high levels of estrogen would be at high risk for heart attack because of their naturally occurring estrogen. So it's not estradiol that's the problem. Let's have that in our heads. Very important. Estradiol is not the problem. What is the problem? It goes back to me previous videos where I talked about the pathways of delivery. Your ovaries will make estradiol and your adrenal gland to a certain degree, and your estradiol goes throughout circulation, does its job, and then it gets eliminated through the liver. Good. Wonderful. And the kidneys a little bit, but mostly liver. So when it's being metabolized out of your body, estradiol, one of the metabolites in the pathway of elimination, it goes from estradiol to something called estrone. Now, estrone is an inflammatory estrogen, as mentioned in the past. You're supposed to have it. It's part of life. But it needs to be less than or equal to estradiol, meaning the pathway needs to move from estradiol to estrone, and there's a few other intermediaries, and then basically eliminate it. Okay? That's the pathway. So when your estradiol is higher than estrone, everything's balanced, everything's moving down a pathway as it should. If estrone becomes elevated, or if estrogen becomes super physiological, we have a problem. Estrogen, among other inflammatory things it does, one of the things it does is it stimulates thrombin. Thrombin is part of the the clotting cascade. So estrogen, when it's high enough, stimulates your body to want to coagulate and increases your risk for coagulopathies and deep vein thrombosis or thromboembolic events, which is basically clots being thrown around. That's where the problem is. How do you get elevated estrogen? As I've mentioned again in previous podcasts, it's in the literature and it needs to be well understood and accepted, is that when you take in estrogen orally, your body preferentially converts that estradiol into estrone to levels that are super physiological. If I give a woman estradiol, I'm always careful what it does in the body. I run my labs. So when I give a woman estradiol, if an injection or any other pathway, pellet, whatever I'm doing, I'm always running her estradiol and I'm running her estrone on the labs. If the estrogen's high, something's wrong. I got to get back down. When a doctor prescribes you oral estradiol, bioidentical estrogen, estradiol, your estrogen levels will always be high, period. Maybe you're that one unique person that doesn't, but just know that that is the most common thing that happens. Oral estrogens, synthetics can do this as well. Oral estrogens in general will increase estrone and increase that clotting problem and increase your risk for cardiovascular events. So when your doctor tells you that you can't do estrogen because it's going to be a risk factor for heart problems, your doctor isn't really getting into the nitty-gritty of why. It's not the estradiol. It's the biomechanics of how it moves through your body. And your doctor doesn't understand, I guess, or is not sure or aware of or educated in the method of delivery and the impact the method of delivery is going to have on you. It's like going to Jiffy Lube and asking for a cake recipe. Not every doctor is going to be good at everything. If you're going to go to your GP, if they don't do this often, it's not that they didn't learn it in school, they did, but they forget a lot of things. We forget certain things. I forgot a lot of my orthopedic stuff. I'm not going to lie to you. I try to remember it, but I don't remember. I got infectious disease still up in here, but not as well as I do endocrinology. Do you know what I mean? So if someone's going to ask me questions about orthopedic, I'm going to give them like, this is my opinion, but this is who I'm going to refer you to. So when your doctor says these things, a lot of times they need to first acknowledge this is my level of understanding in the area. And sometimes they're not doing that. And that's a problem among physicians. I hope that helps. Please know, this is not me diagnosing or giving you treatment. This is me giving you an understanding of where the rationale is, why they made that statement, and why they're telling you that. My advice is to find a physician who specializes in this. Try and find someone who does this, and this is what they do. The other end of it, this could be wrong, would be you see a doctor who just gives everyone hormones and doesn't do any lab work and doesn't watch any of these things. That is definitely worse. You want to be finding the physician who's going to provide you care, true care. You deserve that. So again, I hope this helps. Thank you for tuning in. I'll see you next time.